there is something to do with children that's just unusual about this pandemic. And what I mean by that is usually pandemics, even influenza, but measles, mumps, rubella, pertussis, diphtheria, actually affect the very young and the very old. And it's sort of, it gets the extremes of age. And there's something about COVID-19, and I'll explain in a minute, that spares children more and spares young people more. So meaning that it really, the risk of COVID-19 does increase with older age. This is data from England, but during the phase of the pandemic from March 2020 to February 2021, there were 12 million children less than 18 in England, and 3,000 died during this time of all causes, and 25 of those were from SARS-CoV-2. So that was much less of a rate of death from COVID-19 in children than there were in adults, because 99% of adults before vaccines survived, but that's a very high mortality rate, a 1% mortality rate prior to the vaccines, whereas in children it's a 0.005% mortality rate under 18. Here's data from the CDC. This was just as of this morning, but essentially among children, there have been about 900 and some deaths under 18, and every death is a tragedy, but that compares to 900,000 deaths in it overall in the country. So most of those deaths are in adults. And then you can see the gradation of age, that there is an age stratified aspect of mortality from COVID-19, people who are much older being much more likely to die. That actually has to do, oh, and here in California, we have been really lucky, and 0 to 17, 0% of our COVID deaths have been among 0 to 17-year-olds. Now, we have been, the reason for this major age stratification has to do with the pathogenesis of the virus. The immune system, your immune system, unfortunately, actually contributes to the pathogenesis of the virus. And what that means is your immune system, especially if you're not vaccinated, what's called innate immunity, really hurts your lungs because it attacks the virus in the lungs, which is why we use steroids as a treatment for severe COVID-19 disease. And the innate immune system of children is different than adults. So one reason that children have less severe disease is they just don't even have in their nasal passages the same amount of concentration of the receptor that brings in the virus, which is called the ACE2 receptor. They just have less concentrations of that. And then the second reason, and I encourage you to read this interesting Nature summary of it, is that their innate immune system is different, so that they essentially have higher levels of proteins, these so-called signaling proteins, which tell their immune system that a pathogen is coming. And they don't allow the virus to slip down into the lungs as readily, essentially. And so children it has to do with their innate immune systems, why they're less at risk. That is very unusual, again, for a pathogen. Mostly children are more at risk for some of these childhood preventable illnesses. And so to give a little history of school closures in infectious disease pandemic, because I think it relates to where we are here and now, it was interesting that school closures were always a very last resort for any infectious disease, even if it infects children more, just because children didn't often have a place to go. And so measles, mumps, rubella, diphtheria, pertussis, they were closed, schools were closed temporarily for those illnesses. But for example, in a pandemic setting, the best comparison we can make is to the influenza pandemic of 1918. Now, remember, influenza doesn't differentially spare younger children, so it is really, can be very deadly for very young children. And in the 1918 influenza pandemic, it was very interesting what happened in the United States, because there wasn't such a thing as computers, there wasn't such a thing as remote learning, and essentially schools were not closed, or at the most they were closed for 4 months. In fact, New York City and Chicago, as progressive cities, they were told to close their schools by their health officers, and the public education commissioner said, no, we are not going to close schools because children need food there. 750,000 of our 1 million children in New York are from low income housing and tenements, and we need our children in school. And so they actually declined, absolutely refused to stay, to close our schools at all in New York City, Chicago, and Yale. But in multiple other places of the country, the schools were closed for a short amount of time, about 4 months, and then they opened again with mitigation procedures in place. And I just think this is a very interesting historical article about why in New York, they decided to not close schools. And they essentially said it had to do with the safety and the need for food and in public school system, and to watch children, especially during these chaotic times.